Hi, my name is Letitia Sam. I'm giving a TED Talk on a BSN nursing curriculum. The program structure and model. The program is a Bachelor's of Science in degree and it's 4-year program. There is 8 semesters total, and the delivery is a traditional face-to-face and a couple of online classes, which we could call the hybrid. Then partnership. When we talk of partnership, it is mainly family owned with informal affiliations with other schools such as Colorado Christian University, Baptist University, and University of Colorado. This partnership is such that their lecturers or professors will be invited to give lectures or talk in my school. Method of program. It is articulated. That is to say, the program is planned progression from lower to higher level of learning. It's such as learning from a CNA level, then you move on to LPN, and then associates before the bachelor's degree. Organizational strategy. This corresponds with curriculum philosophy, such as simple to complex classes, and the nursing framework is fundamentals of care, which supports holistic approach. These students get to learn religion and other cultures. This is to enable them to take care of patients in their totality. The philosophy or educational theory. The theory is deep learning, which means learning for understanding. We are also dealing with progressivism. This is growth of students should be the center of educational activities. Whatever they do should enhance their learning in the school. Learning should be relevant to nursing. Now, to discuss the nursing and general education courses, it's a 4-year program, as I said, and every year has 2 semesters. So the first year we could call the freshman year. This is when they take classes like education to professional nursing, and then cultural seminar, ancient classes, and then they have a class THL 1000. It's Christian Faith and Life. They also do general psychology, general chemistry. All this is offered in the first year. They're going to do general chemistry with lab, and then introduction to professional nursing. All together, they're going to offer them 18 credit hours for the first year. The second year, we could call the sophomore year, they're going to take classes like health assessment, practicum in health assessment, human anatomy and physiology 1, and then they will do human anatomy and physiology 2 later on. They'll be offered microbiology, human development, and principles of nutrition. Essentials of nursing practice is part of the classes, and then they have practicals. They'll be offered research and scientific evidence in nursing. Finally, they'll take some statistics classes just to help with their mathematics. The third year, that will be their junior year, they'll be studying nursing care of adults and older adults. They'll also be having practicals, and then they'll start with pharmacology and pathophysiology. Nursing care of women and childbearing, this will be OB, and then they will have practicals. Psychiatric and mental health nursing, which is also a specialty, will be offered, and that will be in their third year. They will be learning global and public health. Some of these students graduate and they want to engage in public health nursing, which is very important in the nursing profession as well. Ethics for healthcare professional will be offered. Senior year is when they're going to take more difficult classes, and they'll be ready because they've gone through with the simple first before getting to the more complicated classes. They will be learning nursing care of adults with complex health problems, and then they'll be having practicals as well. They will also learn nursing care of children and adolescents with practicals. Then we go on to nursing and health policy, and then they will be studying health promotion and home health in the community. All this comes with practicals. Then they'll be ready for leadership and management in healthcare credits, and they will have a field work in leadership. They will also be attending some seminars, which is a 1 credit hour. Altogether, before they complete with the program, they will be studying 136 credit hours. The reason for this organization, this kind of class curriculum, is to prepare students to be in front line to give good patient care, and then they will be prepared for safe, reliable care provision in a special community. By reading periodically, this indicates that a preoccupation with history is necessary to understanding the present. We always mention Florence Nightingale and all the other predecessors. We have learned a lot from the past, and we are applying it to our present. That's why they need to learn some history classes. They learn about our ancient nurses, how they are sequenced. The focus of the program proceeds from the simple to the complex. Throughout the program, classes are scheduled such that students start with simple classes and then they go on to more complex classes. During the daytime hours, from Monday to Friday, they have classes, and then they have a couple of online classes. At the end of this program, students are expected to graduate and then be able to perform health promotion, risk reduction, and disease prevention activities for individuals, groups, and populations. They are also expected to work as members of an interdisciplinary healthcare team. Graduates will make clinical